Welcome to my one-on-one NCLEX tutoring session. In this video, we're reviewing HELLP syndrome, and instead of just memorizing what HELLP stands for, I want to walk you through exactly how to think about it using the NCLEX clinical judgment model. We're going to recognize the cues, connect them, decide what matters most, choose the right nursing actions, and then evaluate whether the patient is improving. Let's start with the cues. So HELLP syndrome stands for hemolysis, elevated liver enzymes, and low platelet. Now, you may see a pregnant patient or a postpartum patient with hypertension. You can also have severe headache, visual changes, nausea and vomiting, and body malaise. But one thing I want you to pay close attention to is this one: right upper quadrant pain, or what we call epigastric pain. Why? So we know it's right upper quadrant pain because that's where the liver is located. So why are we more concerned about that right upper quadrant pain or epigastric pain? Because the pain may again signal liver involvement. Now, let's look at the labs, right? Look at these labs, right? So the platelets are dropping. You see the AST and ALT, which are liver enzymes that are also elevated. And then you see evidence of hemolysis. But recognizing individual findings like this is not enough. NCLEX wants you to connect them, meaning to say you have to analyze the presenting cues. When right upper quadrant pain occurs together with elevated enzymes, as you can see with the AST and ALT, and then you also have thrombocytopenia in the form of low platelet, those findings should no longer look like a separate problem. Together, they are going towards the HELLP syndrome. And once those cues begin to cluster, the question changes from what is happening to what could happen next. That takes us directly into prioritizing the most dangerous complications and deciding what this patient needs first. So the priority hypothesis in their particular scenario is the worsening HELLP syndrome with risk for maternal and fetal compromise or deterioration. Think about what these abnormal findings can lead to. Now, low platelet increases the risk for bleeding, right? Liver involvement can even worsen rapidly. The patient is also risk for seizures, placental abruption, disseminated intravascular coagulopathy or DIC, and fetal compromise. So now we need to generate solutions on how to tackle this issue. The first goal really is to stabilize the mother. That's the most important thing. How do we do that? Or what are the answers you're looking for? Monitor the blood pressure, neurostatus, monitor the urine output, monitor the platelet count. You also monitor the liver enzymes as well as the fetal status. Now, anticipate for HELLP syndrome that magnesium sulfate may be administered in order to prevent seizure. And an antihypertensive medication can be used as a therapy for severe high blood pressure. We also need to make sure that we maintain IV access because this patient may need medications, fluids, and blood products because of that risk of bleeding. And remember this important point: the definitive treatment for HELLP syndrome is the delivery of the baby. Okay? But the patient must be assessed and stabilized first. Once you know the risk and have a plan, NCLEX moves you from thinking to doing the plan. Now we need to decide which actions cannot wait. So that means we need to take action. So for taking action, think of rapid assessment, stabilization, and preparation for escalation of care. Very important here. Continuously monitor the and fetal monitors, right? We need to continuously monitor that. Initiate seizure precautions. Remember the risk for seizure. Administer magnesium sulfate as well as an antihypertensive as ordered. Monitor strict INO because declining urine output may indicate worsening renal perfusion or organ perfusion. Trend the platelet count and liver enzymes rather than looking at a single lab value. Prepare blood products if necessary, especially if severe thrombocytopenia or bleeding develops. And if maternal or fetal status continues to deteriorate, prepare for the delivery of the baby. But clinical judgment does not stop after an intervention. You have to ask this: did what we did actually work? That's where evaluation of the outcome is very important. We want blood pressure control, no seizure activity, adequate urine output, stable and improving laboratory values, and reassuring fetal status. If platelet count continue to fall and liver enzymes continue to rise and urine output continues to decrease or fetal status worsening, the condition is not improving and further intervention is needed. So now let's put the entire clinical judgment pathway together because this is how I want you to think when help appears in an NCLEX question. Okay, so let's start with recognizing the cues. Look for right upper quadrant pain or epigastric pain. That's very important. Hypertension, headache, elevated enzymes, as you can see there, hemolysis, and failing platelet. The next thing is analyze the cues. Connect all these findings together. So liver involvement plus thrombocytopenia plus hemolysis should make you think of HELLP syndrome. The next, we go to the prioritization of hypothesis. Stabilize, so your concern is maternal and fetal deterioration, including seizure, bleeding, abruption, DIC, and fetal compromise. The next thing is we generate solutions. Stabilize the mother, that's very, very important. Monitor the fetus, trend laboratory values, control severe hypertension, prevent seizures, and anticipate delivery. Then to taking the actions or the interventions. Continue close monitoring, give ordered medication. We need to maintain an IV access because we need fluids or perhaps blood products. Institute seizure precautions because of the risk for seizure and prepare for escalation or the delivery of the baby. And then last but not least, look for stabilization of blood pressure, adequate urine output, no seizures, improving laboratory trends, and reassuring fetal status. So here is the NCLEX NCLEX takeaway. Do not memorize HELP as three abnormal lab values. Think of it as a progressive obstetric emergency. Right upper quadrant pain plus elevated liver enzymes plus falling platelets should immediately change your level of concern. And when NCLEX asks what matters most, think maternal stabilization, seizure precautions, fetal assessment, and preparation for delivery. So this is HELP syndrome through the clinical judgment model lenses. For those of you who are taking your NCLEX exam pretty soon, review this video often to get the idea of what HELP syndrome is.